Hi, it's Dr. Kostelnik with Rooted Behavioral Education. I want to talk to you in this video about one of the evidence-based psychotherapies for anxiety and depression that might occur with vestibular disorders. We know that people with vestibular disorders are 3 times more likely than others to experience anxiety and depression, so this is really important. So evidence-based means it has been shown in research to be effective. And there's a lot of evidence to show that this therapy is effective with chronic illness in general. And there's actually some more recent evidence for vestibular disorders in particular, which is exciting. And this therapy is called cognitive behavioral therapy, or CBT. And you've probably heard of it. You'll find that physicians, if they've heard of a psychotherapy, this is the one they'll probably recommend because it is so research driven. There's a lot of data behind it. So let's talk about what it is. So it was developed in the 1960s by a psychiatrist named Aaron Beck. And what Aaron Beck noticed with his patients was that people were staying stuck in their depressive symptoms because they had this negative thinking style. So CBT focuses on changing or balancing or reframing the way that we think. It's called cognitive restructuring. That's kind of the basic foundation of it. It also focuses on behaviors. So things like avoidance, which is huge with vestibular disorders, avoiding things that we're afraid is going to make us feel worse, which can be problematic. So thoughts, behaviors, and then the third one is physiological sensations, or how we feel in our body. And the way that we can target that is by various exercises that help calm the sympathetic nervous system or help kind of make the parasympathetic system more robust. So it would be things like diaphragmatic breathing, progressive muscle relaxation, biofeedback, and what I'm talking to you about is called the cognitive model. So the cognitive model says there's in any given situation, it's going to lead to thoughts, behaviors, physiological sensations, and emotions. And so we can intervene or try to do exercises to improve thoughts, behaviors, and physiological sensations. The fourth one in that cycle is emotion. We can't intervene directly on that. I can't tell you stop feeling anxious. It's thought to be a byproduct of the other 3. But the other 3 present a big opportunity for us to be able to intervene to help change that cycle. One last note on the cognitive model is there is something else that underlies all of that called core beliefs. And core beliefs are thought to develop by around age 5. So it's highly related to our early child experiences. So the environment that we grow up in, our caregivers and how they treat us. And they're the beliefs we have about ourselves, the world around us, and our futures. And it's thought that that colors any situation we might be in and how we react to that. So that's kind of a quick snapshot of CBT. So if you were to go see a CBT therapist, you'd probably start identifying situations and how you're reacting in terms of thoughts, behaviors, and physiological sensations. And then later on in therapy, you might delve into the core beliefs. And delving into that typically is more, I guess I would say, complex, because it's really at the heart of who you are, and it requires a strong therapeutic relationship. So if you're interested in finding a CBT therapist, I'm sure I'll make another video on some tips about how to do that, but feel free to contact me, rootedbehavioraleducation.com. I'm on Instagram or Facebook. You can email me at info@rootedbehavioraleducation.com. And until next time.